Hi everyone, I hope you're well. In this video, we are going to discuss about Lucia Jig versus Leaf Gauge. As you know, these both appliances are used to deprogram muscles and record CR, but they are not the only way to record CR. There are other ways you can record CR. However, these are the two my favorite ways how I record CR. So what is a Lucia Jig? Lucia Jig is made using acrylic, Duralay acrylic resin or Botsford trim resin, and the benefit of this is that it sets hard, so you can create sort of different markings and create these fancy arrows. But the main advantage of that is that you can create some markings so that you can get the point contact where patient's jaw doesn't go further back than that. So when you're recording patient's CR and when you are applying some bite registration material and you're asking patient to close their mouth, you know that the patient's going back to that point and not posture forward. So you should be able to see this very easily. Also, you can get nice one point of contact into your Lucia Jig, and that helps really well in assessing it. Of course, you can reuse it if the teeth haven't changed, so you can record this in patients along with patients' laboratory models. The other way to record CR is by using leaf gauge. Leaf gauge is very quick and easy way to record CR or check first point of contact. And what you are going to do is you are trying basically different thicknesses until you find that first point of contact. First you know which is CO, and then add some more leaf gauges, then to make a teeth apart position, and then record your CR. It's a very quick and easy way to record CR than Lucia Jig, because Lucia Jig needs, mixing acrylic, filling around it in patient's mouth, making until it sets, make sure it sets. It has got exothermic reaction, so it gets hot while it's setting, and some patient may find it uncomfortable. You need to make sure you take in and out, it doesn't get locked into the teeth. So that's why many times colleagues prefer leaf gauge to be used instead of Lucia Jig. For me, Lucia Jig, I use Lucia Jig because I've been trained using Lucia Jig, and there are different reasons. If I'm mounting myself, then that helps for me using Lucia Jig, and I'll explain you in a minute. So with regards to the 3 tips of today's video, is one of them is that you need to make sure that you start using leaf gauge first before you start using Lucia Jig. If you start making Lucia Jig first, you may get confused, or you may get disheartened, because it does take a little bit experience and trial and error before you start using Lucia Jig. So start with leaf gauge, it's much easier to use. You can buy leaf gauge in UK. If you are from UK, then Prestige Dental does leaf gauges, so you can get leaf gauge from there. My clinical decision whether I'm going to use leaf gauge or Lucia Jig depends on whether I am going to mount the model or I am just doing occlusal assessment. If I am just doing occlusal assessment and I want to do the load testing, I want to check the TMJ whether it's painful or not on load test, I want to check the first point of contact, I use leaf gauge. It's very easy to use, quick, you don't need to worry about mixing materials, so I use leaf gauge. However, if I am going to mount the model and I am going to use Moico Beauty Wax or any bite registration material to record CR, then I prefer Lucia Jig, because it gives me one stop, hard stop point, and patient cannot squeeze more than that. Also, I can add a flowable composite at patient's CR when the lower jaw is there. It helps me locking their lower jaw into position, so that when I am recording patients, when I'm putting bite registration, I'm very certain that the patient's not moving their jaw forward than what it is their CR. Because sometimes when you record, when you want to record it, the way you would do it, you will take the deprogrammer out, squeeze some material in, ask patient to close, and that's how you would find that your patient biting. Now, some of the colleagues, they do use bite registration material. So from the side. So ask patient to get the CR, patient into CR position, keep everything as it is, squeeze bite registration material from the side. The problem is, if you do that, it's very difficult to mount the model because you don't have much indentation, you have lots of drags, and you might struggle, or technician might struggle to mount the model. And that's why I prefer to squeeze the material onto the tooth and ask patient to close, and then get them into a position of CR. So I hope you found this useful. Start using leaf gauge as soon as you can and start practicing it. If you have any questions, please feel free to contact me on social media or go to my website www.drdevangpatel.com. If you have liked this video, then please share this with your colleagues and friends. And in the next video, we are going to discuss about canine guidance. Is it really necessary? So look out for the next video, and I hope you enjoy this.